This is Area 88 Plastic Surgery Specialist, Dr. Eui-Seok. Facelift included. All surgeries performed in plastic surgery including botox and fillers, are based on the study of anatomy. Without proper knowledge of the anatomy, accidents are inevitable. Facelifts, neck lifts, and forehead lifts in particular, are operations that begin and end with knowledge of dissection. This is no exaggeration. World-famous masters of facelift surgery are famous for their surgeries, but they also hold a deep understanding of the human anatomy. It is widely assumed all doctors are apt in anatomy, and that plastic surgeons especially, must have mastered facial anatomy. This is not particularly the case. Don't you study anatomy in university? You may wonder. Of course you learn. However, plastic surgery is not a single field. It is divided into trauma, anomalies, hand, reconstruction, trunk and lower extremity, and aesthetics. The beauty field then divides into eyes, nose, facelift, etc. You learn these as an undergraduate over the course of 4 years. When I became a plastic surgeon in 2002, I focused on the study of facial anatomy. I have been dissecting for 17 years since 2004. A lot of time, effort, and money have been invested, and I've been continuing to do the same till this day. This is because the study of anatomy is advancing continuously and medical imaging technology is also advancing in ways we've never seen before. Thus it is very difficult, more so for general doctors who are not qualified plastic surgeons to study this properly. There are doctors who perform facelifts that are not certified plastic surgeons. However, a facelift is not an operation done simply by pulling. Also, to study facelift, you need to know its history very well. The history of anatomy, the history of surgical methods, traditional methods that are still performed today, and the anatomy and interpretation behind those methods. Traditional surgical methods are maintained for a reason. This is very important. It is rare truly new methods are ever created. They can all be traced back to already published papers and books. One shouldn't call himself the founder of a new technique when he or she merely tweaked with the original. As a scholar it just seems impolite to newly name such an operation. It is a deceptive act to deceive patients and a very arrogant idea to patent a name as hybrid or whatnot then claim only one can do it. Therefore, when studying facelift, it is important to carefully select and study previously published papers. There is a plethora of very useless papers. In particular, there are many papers written by otolaryngologists about facelift, but truthfully, they are far behind works done by plastic surgeons. The challenge with these numerous papers though, is that you have to read them all to decide whether or not they are useful. In October 2017, during a training course for plastic surgeons, I summarized and presented about 25 papers as imperative articles for successful facelift. These papers should be known well enough to be memorized. With each reading, more is realized. Honestly though, the general public is more interested in before and after photos, not so much in things like these. However, it is only when you know these things exist that you can properly judge the surgery you are receiving not only for facelifts but also for other surgeries. A surgery is defined by its result. So as a doctor it is good to show many before and after photos. However, these photos must be judged objectively. There are cases where pre- and post-surgery photos are manipulated. Lenses or lighting are changed, the angles different, or even photoshopped to make the surgery look good. There are doctors who make such presentations even at academic conferences. The goal is simply to say I've done my presentation. A signature example of this would be the concept of patient model of plastic surgery in hospitals. They even recruit them. Pre-surgery, the patient wears no makeup, then post-surgery she wears them and smiles brightly. Just consider how many side effects have already been caused by plastic surgery makeover TV programs. You must no longer be deceived by these. It is difficult to explain facelift in even any one aspect. Ligament, nerve, fat layer, SMES, muscle, vector, type of thread to use, where to fix it, what surgical method to apply, how will the incision be done. What are the complications, How are facelifts different in men? The neck alone is divided into its specific areas, and the same goes for the forehead. The challenge isn't to know just one thing but rather to understand the whole. In the end, since the face is connected as one, it is necessary to understand both three-dimensionally and the different layers. It is true ordinary people will find these information difficult to understand. However, reflecting their nature as a nation, the Korean people want to know more about the surgery they've received and share them. I recommend you write down any questions you have and discuss it with your doctor before undergoing surgery. This is a great phenomenon. I believe Korea is developing because of these characteristics of its people. However, there are simply too many false information around, thus it should be left to the experts to determine what is right and wrong. However, it is also true many plastic surgery-related businesses were focused on making money. Doctors are responsible for creating distrust through proxy surgeries, promotional events, and irresponsible attitudes. These things are out of date and need to be gone now. We're at an era where we want things to be more specific and concrete, not overpackaged and hollow. Thank you.